Good morning. Dan Guerron from Duke University. I want to thank SAGES and the panelists for the privilege of the podium. I'm presenting asthma medication usage is significantly reduced following bariatric surgery. These are my disclosures. In 2015, 600 million people were diagnosed with obesity. And since the 1980s, 70% doubled the prevalence of obesity. This is no different in the United States. We have a prevalence about 20 to almost 35%, a prevalence of 35% in the country, with no state with less than 20% prevalence. And this is no difference in the obese population with asthma. We can see that the percentage of adults who are obese is around 38.8%. And it's kind of follows the same distribution as in the prior maps. So basically, obesity is a major asthma comorbidity, presents with worse asthma control, higher exacerbation rates, greater HER2 or utilization rates, and do not respond to standard control therapy. As you can see, it's closely related to BMI. So the higher the BMI, the higher the prevalence of asthma. And here we can go from 40 all the way to 50, and we see a prevalence of almost 32%. The interplay between asthma and its comorbidity condition plays a significant role in the management of the obese patient. Asthma has some key players like GERD, obesity, sleep apnea, some diet. But the good news is that we have surgery for this. We have metabolic and weight loss surgery, and in this paper published by Dr. Bredhauer, we can see that the asthma can be improved or resolved in about 82% of the patients. But what exactly that means and how can we translate that to our patients? It was our question, but we can tell them that the asthma can be improved. We can reduce the rescue inhaler use, improve the quality of life, reduce number of asthma exacerbations, and so forth. But there's still no a number or a figure that can tell the patients exactly what is going to be the resolution. So for that, we decided to conduct a study to determine the longitudinal numbers of prescribed asthma medications assessed pre-op and post-op. Also, we wanted to determine if there's a decrement in asthma medications after bariatric surgery and to evaluate the effect of time, procedure type, time and procedure interaction, and other risk factors in the number of asthma medications. To that, we looked in a retrospective manner in our database from 2000 to 2015, all the patients with at least one asthma medication. Preliminary analysis showed that greater than 85% of our patients have missing data after 4 years, so we decided only to use the first 3 years. The N for this study was 751. As you can see, the distribution of the cases with a predominance of gastric bypass. And then we studied the demographics, weight, BMI, comorbidities, medications, and complications. And doing a regression analysis, we wanted to evaluate the effect of time and procedure type and the number of asthma medications while adjusting for other risk factors. The mean age was about 46 years with a predominance in female patients, about 87%. The mean weight was almost 300 pounds, corresponding to a BMI of 49, and this was heavily influenced by the duodenal switch population. And the med count of asthma the mean was 1.4 with a range of 1 to 4 medications. This just depicts the prevalence of other comorbidities in our cohort. This is a graph depicting the weight, the BMI trend between procedures. Again, starting at a mean of 49 and dropping all the way down to 34. The duodenal switch was the largest postoperative BMI loss with a change at 1 year of 19.87. While the band showed the smallest post-op BMI loss with 5.7 at 1 year. In terms of med counts, we report that starting at 30 days, the med counts drop to from 1.4 to 1, and it's sustained all the way to 3 years in our cohort here. At 1 year, the follow-up was 69% of the patients. Please note in here, there was an elevation of the med count in sleeve gastrectomy, not significant, and we think that this was attributed to a low sample size. Again, a picture of the asthma count medications, seen a drop at 30 days and sustained all the way to up to 3 years. And again, we see that elevation in the 3-year mark at the sleeve, but again, is not significant. It's probably due to a small sample size. Our regression analysis showed pretty interesting results. So all of the changes and the drop in asthma medications were significant, again, at 30 days, all the way to 3 years. And this was not influenced by gender or age, but it was influenced by the presence of GERD medication and BMI. We can see that starting at 30 days, the percent of asthma medication drop is 27%, to 37% at 6 months, 44 at 1 year, and 46 at 3 years. The influence of GERD medication, the patients reporting use of at least one preoperative GERD medications were associated with 12-point higher asthma medication use compared to those that were not taking any GERD medications. Whereas the influence of the BMI, in our analysis, with a 10-unit increase in preoperative BMI, the average number of prescribed asthma medications was 8% higher. So in summary, bariatric surgery reduces the usage of asthma medications starting at 30 days and sustain up to 3 years, regardless of the procedure type. And this is strongly influenced by BMI and GERD. If the patient are consuming GERD medication, there's a 12% higher asthma medication, whereas the heavier the patient, there's an 8% higher chance of asthma medications. The future in our institution, we're having ongoing investigations to assess the physiological and metabolic changes of bariatric surgery in the cellular and molecular levels with airway inflammation and resistance. Thank you.